Good morning, friends. Today we are going to talk about anterior abdominal wall (AAW) and its little bit clinical anatomy. So, anterior abdominal wall, as the name suggests, it is something which is present in the abdomen. It is having some layers of muscles and it is present anteriorly. And there will be something known as posterior abdominal wall also. So let's just first begin by defining something like what is abdominal cavity. So this particular cavity is present between the thorax and the lower limbs. So this particular cavity will be known as abdominal cavity. It contains many abdominal organs which are covered by peritoneum and some are also not covered by them. Then the second picture is of abdominal wall. So this is the covering of that particular cavity which covers the wall from all around, that is from anterior, lateral and posterior part. And typically we are going to today talk about this much portion that is known as anterior abdominal wall which is present anteriorly. So abdominal cavity, again we'll talk about abdominal cavity. This is a space within the body. It is separated from the rest of body by some boundaries. Like superior boundaries, there is diaphragm and posterior margins. Posterior margins means margins of ribs. Then posteriorly, it consists of thoracic spines and posterior abdominal wall. And inferiorly, it is separated or is continuous with pelvic cavity. These two are separated by pelvic inlet. So this is what is known as the abdominal cavity. From lateral side also you can see the same thing. So superiorly the margins will consist of diaphragm and posterior margins. Posteriorly it will be thoracic spines and posterior abdominal wall. Inferiorly it will be pelvic inlet. There are certain bony landmarks which we should be knowing it. So first one is Ziphioid process. You can see here Ziphioid process. This is the lower part of the sternum. Then there are posterior margins. Posterior margin means the margins of ribs which are going moving downside. Then ASI, which is anterior superior iliac spine. This is the part of ilium. Then inguinal ligament, pubic tubercle, iliac crest. These are certain points which we have to know beforehand before learning the abdominal cavity or abdominal wall, because many of the origin and insertions of the muscles are going to happen here. So talking about abdominal wall directly. So the abdominal wall is continuous structure surrounding whole of the abdominal cavity, and regionally it can be divided into three parts: anterior wall, posterior wall and lateral wall. The anterior wall will be placed on the anterior side, posterior wall will be placed posteriorly with the help of spines and certain metal, and then laterally it is in the sidewise of the thing. So like this we can understand what we are going to talk about. So this will be a covering of whole of the abdominal cavity. So typically we see anterior abdominal wall is a nautical term that includes the anterior wall and both the lateral walls also. So first of all it is composed of skin. Then when we remove skin there will be fascia. Then certain muscles and connective tissues will be there. And these are the dermatomes which we are typically going to talk about, especially T5 to T12. There will be special points will be umbilicus as T10, groin and rectum as L1, ilioinguinal nerve L1, and genitofemoral L1 and L3. These are certain dermatomes which we are going to keep in our mind. Functions: apart from the gross body movements, the abdominal muscles are also going to play some more important functions like protection of abdominal organs from anything, injuries and anything, or then postural support. They help in the standing, childbirth, especially in the cases of women's. Then defecation and urination, they are also going to help about them. Then breathing, then coughing and singing also they are going to help her. So this was all about the overview, anatomical overview of the anterior abdominal wall. Now we will talk about layer by layer. So the anterior abdominal wall is an intricate structure with many layers. It is important to able to discern between the and understand this layer in order to fully classify. So you can see first of all there is a skin, then subcutaneous tissue above the level of umbilicus, the subcutaneous fatty layer below the level of umbilicus, there will be superficial fatty layer. Then there is deep membrane layer also in the subcutaneous tissue only. Then there are muscles, Different muscles are there: external oblique, internal oblique, transversus abdominis, and their epiphyseal. Then investing fascias are there. The investing fascia is three layer: deep, intermediate, and superficial. Then transversalis fascia. It is continuous layer of thin connective tissue lining the internal surface of abdominal cavity. Then extraperitoneal fat, which lies between the peritoneum and transversalis fascia, and ultimately there is peritoneum. It is a specialized membrane that lines the abdomen and covers the abdominal and pelvic organs. So this is the layering of the anterior abdominal wall. Next important thing is the muscles arrangement. So muscles, there are five muscles which can be divided into three flat and two vertical muscles. So we'll talk about origin insertion in separate slides. Right now we are only going to understand their locations. The flat muscles you can see external oblique, internal oblique, transversus abdominis. So if you see the external, we'll first see the external oblique. External oblique, this is the shape of the external oblique. Then you can go through the internal oblique. It is the more medial. Then transversus abdominis. Then vertically you can see pyramidally, which is very lower one, small one, and rectus abdominis. On the lateral view also you can see the same things. Rectus abdominis, pyramidalis, the lower part, transversus abdominis, which is more lateral, internal oblique, external oblique. So these layers of the muscles and anterior wall are not obvious as some other body areas, and more on later on we are going to talk in more detail. So if you talk about the external oblique, so external oblique, its origin is from external aspect of the rib 5 to 12 along a line extending posteriorly and inferiorly. Now what is insertion? Insertion is linea alba, pubic tubercle, anterior half of iliac crest and inguinal. So very big insertion is there. Now supply thoracoabdominal nerve, that is anterior rami of T7 to T11, and subcostal nerves are going to supply. On action, it compresses and supports the abdominal viscera, flex and rotate the trunk to contralateral side. So this is external oblique, which is a flat muscle. Next is the internal oblique, also a flat muscle. The origin is thoracolumbar fascia, anterior two-third of iliac crest, lateral two-third of inguinal ligament. Insertion, inferior border of rib 10 to 12, linea alba, pubis via conjoined tendon, nerve supply, thoracoabdominal nerve, that is anterior MI of T7 to T11, subcostal and first lumbar nerve action, compresses and supports the abdominal viscera, flex and rotate the trunk to the ipsilateral side. So this is about the internal oblique. Transversus abdominis. The origin is the internal aspect of costal cartilage of the ribs 7 to 12, thoracolumbar fascia, iliac crest, and connective tissue deep to the inguinal ligament. Insertion is linea alba with aponeurosis of internal oblique, pubic crest, and pubis via conjoined tendon. Now, innervation, again the same innervation is there. Action compresses and supports the abdominal viscera. So this white line which you see, this is actually linea alba. Okay. Next, the vertical muscles. First one is pyramidalis, is a small muscle. Its origin is pubic crest and pubic symphysis. Insertion is on linea alba, nerve supplied by subcostal nerve. It tenses the linea alba. It is a vertical nerve. And the last one is rectus abdominis. Origin is from pubic symphysis and pubic crest. Insertion is on Ziphite process and costal cartilage of rib 5 to 7. Nerve supplies thoracoabdominal and subcostal nerve, that is T7 to T12, anterior MI. It flexes lumbar vertebrae, compresses the abdominal visceral, stabilizes and controls the anterior pelvic. So this was some origin insertion about the anterior abdominal wall muscles, which you have to learn. And mostly the question also comes like this: define the muscles of anterior abdominal wall. So next main thing is rectus sheath. So rectus sheath is a strong fibrous sheath enclosing the rectus abdominis muscle. It can be broken into anterior and posterior sheath. It consists of aponeurosis of three flat anterior abdominal wall muscles. So first you see the aponeurosis. It is aponeurosis means broad, flat, bilaminar ligament extending from mid-clavicular line to medial linea alba. In linea alba, it is a dense band of midline that acts on an attachment on the site of muscles, the middle line. Mid-clavicular line, as the name suggests, imaginary line that runs vertically through the middle of each clavicle. Arcuate line, this is a crescent or moon-like shaped, half moon-like shaped line marks inferior limit of the posterior layer of rectus sheath. Lineus semilunaris, curved lines along the lateral border of rectus sheath abdominis. Then, very important, inguinal ligament. It is a folded border of external oblique muscle aponeurosis extending between the ASIS and pubic. This is a very important separate topic because inguinal ligament means the inguinal canal is there, the inguinal hernia, and many other things are there. We will talk about some other place about this inguinal. So these are the layering of the rectus sheath. Next, aponeurosis that makes the rectus sheath of bilaminar, meaning have posterior and anterior lamina. Bilaminar means two. Different muscles, even different lamina of same muscles run posterior or anterior to the rectus abdominis. So if you see the external oblique, the anterior and posterior lamina of the external oblique are both in the anterior sheath, you can see. The internal oblique, the anterior lamina resides in the anterior sheath and the posterior lamina resides in the anterior sheath inferior to the arcuate line and posterior sheath above to the arcuate line. Well, three level it will be three different. Then transversus abdominis, both the anterior and posterior lamina are in the anterior sheath inferior to the arcuate line and in the posterior sheath superior to the arcuate line. So this was the anterior view. We can also see the sagittal view about this. So you can see this is external oblique, see the differences. Then internal oblique, transversus, and then transversus fascia. In cross section, if you want to see, it's more easier to understand here. So you can see the superior to arcuate line, this will be inferior to arcuate line. Then this is external oblique, internal oblique. You can see internal oblique is covering both the things in the above to the line, but below to the line it is a very thin, flat-like thing. Then transversus abdominis. Here it is flat. Here it is again going above to the muscles, erectus sheath. Okay, so this is what sheath is going to tell us. Then let's see about the some vascular supply. So it is important to understand how the blood vessel resides inside the intricate layers of the rectus. So the first one is superior epigastric, second one is inferior epigastric. Superior epigastric is the continuation of internal thoracic artery, very important. Internal thoracic artery enters the posterior sheath beneath the rib cage and runs deep to the rectus abdominis. Anastomosis with inferior epigastric artery above the level of umbilicus. Then inferior epigastric, you can see the inferior epigastric in green color. It originates from external iliac artery deep to the inguinal ligament, runs with transversus fascia until the arcuate line, and osmosis with the superior epigastric artery in the posterior portion of the rectus sheath. So this small presentation you can see or understand the rectus sheath or anterior abdominal wall as a whole. Anterior abdominal wall is an important structure, first of all due to the herniation and then due to the covering. And the muscle arrangement is very specific, external oblique, internal oblique, then the transversalis and then pyramidalis and then rectus. So just before finishing, we are again going to see the muscles only. So you can see the arrangement. Rectus abdominis, the packs which we see normally in the big good built body, these are the packs which show that is rectus abdominis only. And pyramidalis is the small muscle, smallest you can see in this group. And transversus abdominis, it is on the transversus side. The internal oblique and external oblique are crossover to each other. So that's all from this slide. I think it is clear to you. Thank you.